Good evening, guys. I hope you are doing all well. Yeah. So, good evening, Aditya, Anjali, and Ashok. A very good evening to everyone, students who have just joined. So, beta, we are here to discuss about the new drugs which have been approved from November 2025, 2023 to May 2025. Okay. And remember, what about the previously approved drug? Remember, for previously approved drug, I have taken a previous session, and you can see this session on the given link below, which I will be providing to you after the session is over. The PDF will be shared in the Telegram group, and you can check the newly approved drug before November 2023 in a similar video in this similar channel. So without wasting any more time, let's start with the variously approved drugs. So how we will be approaching this chapter? First, I will tell you the name of a disease on the top. I will tell you the standard treatment of the disease which is currently available. जो अभी तक treatment available है हम वो discuss करेंगे और उसके बाद हम discuss करेंगे the newly approved drug. Agreed? The newly approved drug. So let's start with the most important drugs first. So the first drug which has been approved for NASH. We all know NASH stands for non-alcoholic steatohepatitis. Non-alcoholic steatohepatitis, in simple word, it is known as fatty liver. And remember, for the treatment of fatty liver till now, just a second. Yeah. For the treatment of fatty liver, the treatment which has been approved is to control the risk factor for fatty liver. There is no single drug has been approved specifically for the treatment of NASH. So the first drug which has been approved for the treatment of NASH is resmetirom. So resmetirom is first in class drug. First in class drug means it is the first drug which has been approved for NASH. Now remember one point. Just a second. Let me adjust my camera. Yeah. So what is this resmetirom? Resmetirom is basically thyroid hormone receptor. That is THR. Which type of receptor? We will write beta receptor agonist. Remember, THR or thyroid hormone receptor beta, they are present inside the liver, while all other thyroid hormone receptors are present elsewhere in the body. And the function of thyroid hormone receptor, if we stimulate this receptor by resmetirom, it will reduce the production of triglycerides in liver. Triglyceride means fat production in liver is reduced by resmetirom. So can we say it is a simple drug given for the treatment of fatty liver? Now, what is the previous or standard treatment of NASH? So we have to control risk factor. The first risk factor for NASH is diabetes mellitus. So that is why we have to treat diabetes mellitus by insulin. We have to give metformin, etc. And all drugs for diabetes, they reduce the risk of NASH. Another risk factor for NASH is dyslipidemia. Dyslipidemia means when there is excessive triglyceride and cholesterol in the blood. So to control the excessive fat in blood, we can give statins. We can give omega-3 fatty acid. We can also give vitamin E. Vitamin E is an important MCQ for your exam. And lastly, it has been seen that aspirin in low dose also decrease the risk of NASH. But what is the specific drug approved for NASH? The specific drug approved for the NASH is resmetirom. Okay, resmetirom. So try to remember, it's a potential question. Next new drug we have to remember is shortest beta blocker. Till now, all the beta blocker we know, they end with the word LOL, LOL. Till now, the shortest beta blocker was esmolol. इस्मोलॉल अभी तक शॉर्टेस्ट बीटा ब्लॉकर था बेटा, इसकी हाफ लाइफ थी 9 मिनट्स की। वाई इट वॉज द शॉर्टेस्ट एक्टिंग बीटा ब्लॉकर? जैसे ही हम स्मोलॉल देते थे ये ब्लड में आता था और ब्लड में ही ये डीग्रेड हो जाता था या इनएक्टिव फॉर्म में कन्वर्ट हो जाता था। तो ब्लड में एक एंजाइम होता था बेटा, प्लाज्मा एस्चेरेस एंजाइम। So this plasma esterase enzyme rapidly degrades or metabolizes ismolol, but 2-3 months back we have developed a new beta blocker, landiolol. And if you talk about the half-life of landiolol, it is just 4 minutes. So can you tell me now which is the shortest acting beta blocker? It is now not ismolol, it is landiolol, and landiolol it is degraded by another enzyme in our plasma, that is plasma सूडोकोलिन एस्चेरेस। सूडोकोलिन एस्चेरेस से डिग्रेड हो जाता है लैंडियोलॉल। तो रिमेंबर, इस्मोलॉल एस्चेरेस से डिग्रेड होता है, लैंडियोलॉल सूडोकोलिन एस्चेरेस से डिग्रेड होता है। एंड रिमेंबर, both these beta blocker where they are used, we know that on our heart we have beta 1 receptor on SA node. So if you block this beta 1 receptor on SA node, can we say the heart rate will reduce? So that is why both these beta blocker have been approved in the treatment of SVT. What is SVT? SVT beta we all know is supraventricular tachycardia, like atrial flutter and atrial fibrillation. But recently this landiolol, it has been approved for SVT as well as VT. इसे VT के लिए भी अप्रूव कर दिया गया है। ये सिर्फ एसवीटी में नहीं दिया जाता, ये एट्रियल रेट को तो कंट्रोल करेगा ही, ये वेंट्रिकुलर रेट को भी कंट्रोल करता है। ओके, नाउ द नेक्स्ट क्वेश्चन वी हैव इज एंडोथिलिन एंटागनिस्ट। नाउ बेटा, व्हाट डू यू मीन बाय एंडोथिलिन? रिमेंबर, ऑन आवर ब्लड वेसल हम सब जानते हैं एंडोथीलियल सेल्स होते हैं, और एंडोथीलियल सेल्स क्या रिलीज करते हैं? एक मॉलिक्यूल रिलीज करते हैं, एंडोथिलिन। सो एंडोथिलिन इज प्रोड्यूस्ड बाय एंडोथीलियल सेल, और एंडोथीलियल सेल्स का जब एंडोथिलिन रिलीज करते हैं इट कॉजेस वेजो कंस्ट्रिक्शन। एंडोथिलिन कॉजेस वेजो कंस्ट्रिक्शन। अब बताइए बेटा, अगर वेजो कंस्ट्रिक्शन होगी तो ब्लड प्रेशर पे क्या फर्क पड़ेगा? यस, ब्लड प्रेशर विल इंक्रीज। So can you tell me where endothelin antagonist will be used? Very logically, एंडोथिलिन एंटागनिस्ट क्या करेंगे बेटा? ये वेजो डायलेशन करेंगे और ब्लड वेसल में ब्लड प्रेशर को कम करेंगे। नाउ हाउ टू आइडेंटिफाई एनी एंडोथिलिन एंटागनिस्ट? अगर हम बात करें प्रीवियसली अप्रूव्ड एंडोथिलिन एंटागनिस्ट, दे वर बोसेंटान, एम्ब्रीसेंटान, मैसीटेंटान। तो अगर आप देख रहे हैं इन सब ड्रग्स के एंड में क्या वर्ड आ रहा है? एंटान वर्ड आ रहा है। क्यों आ रहा है बेटा एंटान वर्ड? एंटान वर्ड बेटा इसलिए आ रहा है, एंडोथिलिन, ENT मींस एंडोथिलिन, AN मींस एंटागनिस्ट। नाउ बोसेंटान, मैसीटेंटान एंड एम्ब्रीसेंटान, दे आर अप्रूव्ड फॉर पल्मोनरी आर्टरी हाइपरटेंशन। ये लंग्स में वेसल को डायलेट करेंगे और पल्मोनरी आर्टरी हाइपरटेंशन के लिए अप्रूव्ड है। बट अ न्यू ड्रग इज एप्रोसिटेंटान। दिस इज इंपॉर्टेंट। एप्रोसिटेंटान, इट इज द फर्स्ट इन क्लास ड्रग। ये पहला ऐसा ड्रग है, फर्स्ट इन क्लास ड्रग, विच इज अप्रूव्ड फॉर रेजिस्टेंट हाइपरटेंशन। किसके लिए अप्रूव्ड है बेटा? रेजिस्टेंट हाइपरटेंशन के लिए अप्रूव्ड है। ना बेटा, रेजिस्टेंट हाइपरटेंशन होती है जो पूरी बॉडी में हाइपरटेंशन होती है, जिसमें हम देते हैं थायजाइड डायूरेटिक्स, एस इनहिबिटर्स, कैल्शियम चैनल ब्लॉकर लाइक एम्लोडिपिन। तो अगर हाइपरटेंशन 3 ड्रग्स से कंट्रोल नहीं होती, 3 ड्रग्स के कॉम्बिनेशन से कंट्रोल नहीं होती, उसे हम बोलते हैं रेजिस्टेंट हाइपरटेंशन। और रेजिस्टेंट हाइपरटेंशन में अभी तक जो अप्रूव्ड ड्रग था वो था स्पाइरोनोलेक्टोन। और बेटा स्पाइरोनोलेक्टोन क्या था? वो एल्डोस्टेरॉन के रिसेप्टर को ब्लॉक करता था। इट इज एन एल्डोस्टेरॉन ब्लॉकर। बट वी हैव अ न्यू ड्रग, एंडोथिलिन एंटागनिस्ट, अ न्यू ड्रग अप्रूव्ड फॉर रेजिस्टेंट हाइपरटेंशन। ठीक है, बोसेंटान कहां दिया जाता है? पल्मोनरी आर्टरी हाइपरटेंशन में, और एप्रोसिटेंटान दिया जाता है रेजिस्टेंट हाइपरटेंशन में। तो नाउ लेट्स टॉक अबाउट पल्मोनरी आर्टरी हाइपरटेंशन, जिसमें लंग्स में क्या होता है बेटा? लंग्स की ब्लड वेसल्स में वेजो कंस्ट्रिक्शन हो जाती है। इसके लिए प्रीवियसली अप्रूव्ड ड्रग वी हैव ऑलरेडी डिस्कस्ड। द फर्स्ट क्लास ऑफ ड्रग वी गिव इज प्रोस्टाग्लैंडिन I2, प्रोस्टाग्लैंडिन I2 देते हैं, इससे वेसल डायलेट हो जाती है लंग्स की। दे आर द ड्रग ऑफ चॉइस फॉर पल्मोनरी आर्टरी हाइपरटेंशन। तो इन ड्रग में आपने प्रोस्ट वर्ड ढूंढना है, लाइक ट्री प्रोस्टिनिल, इपोप्रोस्टिनॉल, इलोप्रोस्ट, प्रोस्ट वर्ड ढूंढना है। और अभी हमने पढ़ा एंडोथिलिन एंटागनिस्ट लाइक बोसेंटान, एम्ब्रीसेंटान, मेसिटेंटान, ये हम देते थे पल्मोनरी आर्टरी हाइपरटेंशन में। प्लस वी ऑल्सो गिव पीडीई, पीडीई बेटा स्टैंड्स फॉर फॉस्फो डाइएस्टेरेस इनहिबिटर। स्नेहाजीत, एप्रोसिटेंटान इज एन ओरल ड्रग, ओके, एप्रोसिटेंटान इज एन ओरल ड्रग। सो फॉस्फोडाइएस्ट्रेस 5 इनहिबिटर, सिल्डेनाफिल, टडालाफिल, सिल्डेनाफिल जो वाइग्रा है जिसे हम इंपोटेंस में देते हैं, इरेक्टाइल डिसफंक्शन में देते हैं, इसे हम पल्मोनरी आर्टरी हाइपरटेंशन में भी देते हैं ओरली। बट वी हैव अ न्यू ड्रग अप्रूव्ड दैट इज सोटाटरसेप्ट, सोटाटरसेप्ट। कैसे याद करें? इसमें अगर आप देखें, इसमें 80 वर्ड आ रहा है, इसमें 80 वर्ड आ रहा है और RE सेप्ट वर्ड आ रहा है। 80 से बेटा हम लिखेंगे ये एक्टिविन, 80 से लिखेंगे ये एक्टिविन। देख रहे हैं RE वर्ड आ रहा है तो RE लिखेंगे, और सेप्ट वर्ड आ रहा है मतलब ये एक्टिविन के रिसेप्टर का, एक्टिविन के रिसेप्टर का क्या है? ब्लॉकर है। सो इट इज एन एक्टिविन रिसेप्टर ब्लॉकर या एंटागनिस्ट। It has also been approved for treatment of pulmonary artery hypertension. अब बेटा सवाल है ये एक्टिविन चीज क्या है? रिमेंबर एक्टिविन भी क्या होता है? ब्लड वेसल्स में होता है, लंग की रिसेप्टर होता है एंडोथीलियल सेल पे। अगर ये एक्टिविन रिसेप्टर एक्टिवेट हो जाए तो ब्लड वेसल्स में सेल्स की ग्रोथ होनी शुरू हो जाती है, लाइक फाइब्रोब्लास्ट की ग्रोथ होनी शुरू हो जाती है, जिसकी वजह से पल्मोनरी ब्लड वेसल्स में क्या हो जाती है? वेजो कंस्ट्रिक्शन हो जाती है। तो सोटाटरसेप्ट एक नया मैकेनिज्म ऑफ एक्शन है। इट्स अ ड्रग फॉर पल्मोनरी आर्टरी हाइपरटेंशन विद न्यू मैकेनिज्म ऑफ एक्शन, रिसेंटली अप्रूव्ड फॉर PAH, सोटाटरसेप्ट एक्टिविन रिसेप्टर ब्लॉकर, जिससे ब्लड वेसल्स की ग्रोथ कम हो जाएगी। नेक्स्ट बात करते हैं बेटा पेन के लिए। पेन के लिए हम ड्रग यूज करते हैं एनाल्जेसिक ड्रग, एग्रीड। तो अगर हम बात करें मॉडरेट टू सिवियर पेन, अगर हम बात करें मॉडरेट टू सिवियर पेन, मॉडरेट टू सिवियर पेन में एक नया ड्रग अप्रूव्ड हुआ है सूजेट्रिजीन, सूजेट्रिजीन। कैसे याद करें? जब हाथ पैर सूज जाते हैं, सूज जाते हैं तो क्या होता है? पेन होता है। तो हाथ पैर सूजेंगे तो पेन होगा, और पेन होगा तो हमने एक ड्रग बना दिया सूजेट्रिजीन। अब रिमेंबर बेटा, फॉर मॉडरेट टू सिवियर पेन अभी तक हमारे ड्रग ऑफ चॉइस होते थे ओपियोइड्स। कौन से ड्रग यूज करते हैं सिवियर पेन में? मोस्ट इफेक्टिव पेन किलर होते हैं ओपियोइड। रिमेंबर ओपियोइड्स लाइक मॉर्फिन, हम सबने सुना है नाम, पेथिडीन, फेंटानिल, ये ड्रग हम बेसिकली देते हैं सिवियर पेन में। रिमेंबर प्रॉब्लम क्या है? ओपियोइड्स जो है वो ब्रेन पे काम करते हैं। कहां पे काम करते हैं बेटा? CNS पे काम करते हैं, और CNS पे पेन के रिसेप्टर्स को ब्लॉक कर देते हैं, मतलब पेन की परसेप्शन को या समझ को खत्म कर देते हैं। बट प्रॉब्लम यह है कि ओपियोइड्स क्योंकि ब्रेन पे काम करते हैं, इट इज अ हाईली एडिक्टिव ड्रग। ओपियोइड से एडिक्शन होती है, इसीलिए हमें जरूरत पड़ी सूजेट्रिजीन को बनाने की। तो सूजेट्रिजीन हम लिखेंगे इट इज अ नॉन ओपियोइड ड्रग, इट इज अ नॉन ओपियोइड ड्रग। तो ये ओपियोइड नहीं है। और सर ये किस पे काम करेगा? सर ये ब्रेन पे काम नहीं करेगा सर, ये पेरीफेरल नर्व्स जो ब्रेन में जा रही हैं, ये पेरीफेरल नर्व्स पे काम करता है। तो क्योंकि ये पेरीफेरल नर्व्स पे काम करेगा, कैसे? एस से हमें याद रखेंगे, ये पेरीफेरल नर्व्स पे सोडियम चैनल को ब्लॉक करेगा। किसको ब्लॉक करेगा बेटा? ये पेरीफेरल नर्व्स पे सोडियम चैनल को ब्लॉक करता है। तो क्योंकि ये पेरीफेरल नर्व्स पे काम कर रहा है, सूजेट्रिजीन इट डज नॉट एंटर इनटू द ब्रेन, ये ब्रेन में एंटर नहीं करता। इसका ग्रेट एडवांटेज क्या है? इसका ग्रेट एडवांटेज है इट इज अ नॉन एडिक्टिव, इसका एडिक्शन नहीं होता। इट इज अ नॉन एडिक्टिव पेन किलर या एनाल्जेसिक ड्रग विच कैन बी गिवन इन प्लेसेस ऑफ ओपियोइड्स। एग्रीड? यस, यू आर एब्सोल्युटली राइट। स्नेहाजीत चौधरी, इट इज अ डेरिवेटिव ऑफ लेमोट्रिजीन, ये लेमोट्रिजीन से ही डिराइव हुआ है। तो आपने बड़ा अच्छा पकड़ा है इस चीज को। लेमोट्रिजीन भी सोडियम चैनल को ब्लॉक करता है, पर लेमोट्रिजीन ब्रेन में एंटर करता है, वो एपिलेप्सी वाला ड्रग है बेटा। सुजेट्रिजिन ब्रेन में एंटर नहीं करता, सिर्फ पेरिफेरल नर्व्स पे सोडियम चैनल को ब्लॉक करता है। दैट इज व्हाई इट इज ओनली यूज्ड एज अ पेन किलर। नेक्स्ट बात करते हैं एलोपीसिया की। तो बेटा एक एलोपीसिया तो हम सब जानते हैं बाल्डनेस मेल्स में होती है। जब मेल्स में टेस्टोस्टेरोन या एंड्रोजन्स का लेवल ज्यादा हो जाता है तो मेल्स में एलोपीसिया हो जाता है। तो फॉर द ट्रीटमेंट ऑफ एंड्रोजेनिक एलोपीसिया, फॉर द ट्रीटमेंट ऑफ एंड्रोजेनिक एलोपीसिया जो टेस्टोस्टेरोन या एंड्रोजन से होता है, उसमें हम ड्रग देते हैं मिनॉक्सिडिल विद आइदर फिनेस्टेराइड और ड्यूटास्टेराइड। ठीक है, एग्रीड। मिनॉक्सिडिल, फिनेस्टेराइड या ड्यूटास्टेराइड का कॉम्बिनेशन देते हैं, हम पढ़ते रहते हैं। बट एक और टाइप का एलोपीसिया बात करते हैं, दैट इज एलोपीसिया एरियाटा। एलोपीसिया एरियाटा। सर ये क्यों होता है? जब बेकार में स्कैल्प में क्या होती है? इन्फ्लामेशन होती है। तो इन्फ्लामेशन से होता है एलोपीसिया एरियाटा। अब बेटा हम सब जानते हैं कि इन्फ्लामेशन किससे होती है? साइटोकाइन से होती है। साइटोकाइंस दे प्रोड्यूस इन्फ्लामेशन। और साइटोकाइंस का जो रिसेप्टर होता है डब्ल्यूबीसी पे, वो रिसेप्टर होता है जैक रिसेप्टर। किसी ने वर्ड सुना है जैक रिसेप्टर, जेनस काइनेस रिसेप्टर या जैकस्टैट रिसेप्टर? इसीलिए हमने एलोपीसिया एरियाटा के लिए ड्रग बनाए जो इस इन्फ्लेमेशन को कंट्रोल करेंगे। तो इन्फ्लेमेशन को कैसे कंट्रोल करेंगे? वी मेड अ ड्रग नोन एज जैक इनहिबिटर्स। ये सारे के सारे ड्रग क्या हैं? जैक इनहिबिटर है। जैक स्टैंड्स फॉर बेटा जेनस काइनेस। जैक स्टैंड फॉर बेटा Janus kinase, they reduce inflammation by blocking the receptor of cytokine. अब remember how to identify these drugs. Remember these drugs they will end with the word tinib. They will end with the word tinib. टिनिब वर्ड से एंड कर रहे हैं क्योंकि जेनस काइनेस रिसेप्टर जो है एक टाइप का क्या होता है? टायरोसिन काइनेस रिसेप्टर होता है। तो टायरोसिन काइनेस इनहिबिटर होते हैं ये। टिनिब वर्ड आ रहा है इनमें, ये इन्फ्लेमेशन कम करेंगे। अब बेटा वन वेरी इंपॉर्टेंट पॉइंट, दिस बैरिसिटिनिब ये प्रीवियसली ऑलरेडी अप्रूव्ड हो चुका है एक बीमारी के लिए, आरए के लिए। इसे रूमेटॉइड आर्थराइटिस के लिए हम ऑलरेडी अप्रूव्ड कर चुके हैं। बैरिसिटिनिब अब एलोपीसिया के लिए भी अप्रूव्ड है। तो बैरिसिटिनिब को हमने मॉडिफाई करके बनाया रिटलेसिटिनिब एंड ड्यूरोरुक्सोलिटिनिब। टिनिब टिनिब वर्ड आपने ढूंढना है बेटा। ये जो ड्रग है ये यूएस में अप्रूव्ड है, दे हैव बीन अप्रूव्ड इन अमेरिका, बट ये ड्रग इंडिया में बहुत अच्छे ड्रग नहीं है। दीज ड्रग्स they are not very approved good drug for, yes you all सबने पकड़ लिया आंसर, because these drugs remember they increase the risk of tuberculosis। इनसे टीबी का रिस्क इंक्रीज होता है क्योंकि इम्यूनिटी कम हो जाएगी। तो इंडिया में टीबी इतना कॉमन है, तो डोंट यू थिंक जब ये हम ड्रग ओरली देंगे बाल तो उगाएंगे पर टीबी हो जाएगा? तो वी डोंट थिंक कि इंडिया में ये ड्रग काफी इंपॉर्टेंट या काफी फेमस होंगे ये ड्रग। But now let's talk about next is cystic fibrosis. Cystic fibrosis बेटा एक जेनेटिक बीमारी होती है जिसपे एपिथेलियल सेल्स पे एक चैनल होता है CFTR चैनल, इसमें डिफेक्ट आ जाता है। ठीक है, तो लंग्स में न्यूमोनियास होने शुरू हो जाते हैं, सिक्रीशन हार्ड हो जाती है, पेंक्रियास की सिक्रीशन हार्ड हो जाती है, पेंक्रियास डैमेज हो जाता है। सिमिलरली सैलिवरी ग्लैंड्स भी सिक्रीट नहीं कर पाएंगे, लैक्राइमेटरी ग्लैंड भी सिक्रीट नहीं कर पाएंगे, ड्राई आइज ड्राई माउथ हो जाता है। नाउ सिस्टिक फाइब्रोसिस के ट्रीटमेंट में जितने भी ड्रग हैं बेटा आपने याद रखना है इनके एंड में कैफ्टोर वर्ड आएगा। तो अब आप आइडेंटिफाई कर सकते हैं, इनमें कैफ्टोर वर्ड आपने ढूंढना है। ठीक है, यू हैव टू आइडेंटिफाई विच वर्ड? कैफ्टोर। और ये जो कैफ्टोर वाले हैं, रिमेंबर कैफ्टोर वाले जो ड्रग होते हैं दे आर CFTR पोटेंशिएटर। इनको हम क्या बोलते हैं? CFTR पोटेंशिएटर। मतलब ये CFTR के डिफेक्ट को ठीक कर देते हैं। सो सबसे पहला जो हमने ड्रग बनाया था वो था ईवा कैफ्टोर। ईवा कैफ्टोर हम देते थे G551 डिलीशन में, ये एक म्यूटेशन थी सिस्टिक फाइब्रोसिस में, इसमें हम देते थे। टीजा कैफ्टोर और ल्यूमा कैफ्टोर हम देते थे F508 डिलीशन वाली म्यूटेशन में। एग्रीड। अब बेटा हमने दो कैफ्टोर और बना दिए, वेंजा कैफ्टोर, ड्यूटिवा कैफ्टोर। ये ड्रग भी हम किस में देते हैं? F508 डिलीशन म्यूटेशन में देते हैं। तो बेसिकली CFTR या सिस्टिक फाइब्रोसिस के ट्रीटमेंट में हम इस टीजा कैफ्टोर के साथ वेंजा कैफ्टोर और ड्यूटिवा कैफ्टोर, इन तीनों ड्रग का कॉम्बिनेशन देते हैं, और इस कॉम्बिनेशन को हम देते हैं फॉर द ट्रीटमेंट ऑफ, yes, they are given in the treatment of cystic fibrosis. Agree? Yes. So they are CFTR potentiator या correctors. अब बात करते हैं एक रेयर बीमारी की और जेनेटिक बीमारी की, दैट इज प्राइमरी हाइपर ऑक्सलयूरिया। सो ये भी बेटा एक जेनेटिक बीमारी है। सो इस जेनेटिक डिजीज में क्या होता है, दैट एक एंजाइम है, इसका लेवल बढ़ जाता है, दैट इज ग्लाइको ऑक्सलेट एंजाइम। इस एंजाइम की एक्टिविटी बढ़ जाती है तो गेन ऑफ फंक्शन हो जाता है। तो इस गेन ऑफ फंक्शन होने की वजह से क्या होता है, जो किडनी है इट एक्सक्रीट एक्सेस ऑफ ऑक्सलेट। ऑक्सलेट यूरिन में ज्यादा एक्सक्रीट होता है, जिसकी वजह से ऑक्सलेट स्टोन्स हो जाते हैं यूरिनरी ट्रैक्ट में। सो दिस इज प्राइमरी हाइपर ऑक्सलयूरिया टाइप 1। प्राइमरी हाइपर ऑक्सलयूरिया टाइप 1। अब बेटा इसके लिए जो फर्स्ट ट्रीटमेंट अवेलेबल था, द ट्रीटमेंट विच वॉज अवेलेबल वॉज पायरिडॉक्सिन। हम एक विटामिन देते थे पायरिडॉक्सिन, विच इज विटामिन B6, क्योंकि विटामिन B6 रिमेंबर इनहिबिट्स द एक्टिविटी ऑफ ग्लाइको ऑक्सलेट एंजाइम। बट रिसेंटली हमने दो स्पेसिफिक ड्रग्स बनाए, नीडोसिरान एंड ल्यूमासिरान। अगर हम देखें इन ड्रग्स के एंड में सिरान वर्ड आ रहा है, इन दोनों ड्रग के एंड में सिरान वर्ड आ रहा है। अब आपने एक रूल याद रखना है, किसी भी ड्रग के एंड में सिरान वर्ड आएगा, इसका मतलब क्या होता है, SI का मतलब होता है स्मॉल इंटरफेयरिंग, और रैन में लिखेंगे RNA। इट इज अ स्मॉल इंटरफेयरिंग RNA। इसका एक और भी नाम होता है, इट इज ऑल्सो नोन एज साइलेंसिंग mRNA। इसे हम क्या बोलते हैं, साइलेंसिंग mRNA। मतलब बड़ा सिंपल सा है, हमने क्या किया, एक mRNA का सीक्वेंस बना दिया, और ये mRNA का सीक्वेंस क्या करेगा, नॉर्मल mRNA पे बाइंड करेगा, और नॉर्मल RNA पे बाइंड करेगा तो क्या होगा बेटा, ये इस एंजाइम का जो प्रोडक्शन है कम कर देगा। सारे एंजाइम्स mRNA से बनते हैं। इट विल रिड्यूस द प्रोडक्शन ऑफ ग्लाइको ऑक्सलेट एंजाइम। नेक्स्ट वी हैव इज वन टाइप ऑफ अमाइलॉइडोसिस। अमाइलॉइडोसिस में बेटा क्या होता है, प्रोटीन्स बिकम मिसफोल्डेड, and this misfolded proteins are known as amyloid and they become deposited in organ। क्योंकि ये प्रोटीन्स मिसफोल्डेड है, रिमूव नहीं हो पाते। एग्रीड? ओके, now the point is, yes Snehajit, you are absolutely right, so there is accumulation of this abnormal protein। ये जो एबनॉर्मल प्रोटीन है ट्रांसथायरेटिन, ये क्या होता है, बॉडी में एक्यूमुलेट हो जाता है। और ये कहां पे एक्यूमुलेट होगा, सर हार्ट में एक्यूमुलेट होगा, विच कैन लीड टू डायलेटेड कार्डियोमायोपैथी। बहुत ही डेडली डिजीज है। डायलेटेड कार्डियोमायोपैथी का कोई भी ट्रीटमेंट नहीं होता। सिमिलरली न्यूरॉन्स में डिपॉजिट हो जाता है, न्यूरॉन्स डिपॉजिट डैमेज हो जाते हैं, पेशेंट को क्या हो जाता है, पॉलीन्यूरोपैथी हो जाता है। सो दिस इज द प्रॉब्लम विद ट्रांसथायरेटिन मीडिएटेड अमाइलॉइडोसिस। अब बेटा इसके लिए सबसे पहला ड्रग जो अप्रूव हुआ था वो था टाफामिडिस। अब एक इसी के तरह एक नॉर्मल ड्रग और एक और ड्रग अप्रूव्ड हुआ है, एकोरामिडिस। अब बेटा ये कैसे याद रखें, इन दोनों ड्रग्स के एंड में अगर आप देखें एमिडिस वर्ड आ रहा है, दोनों के एंड में बेटा क्या वर्ड आ रहा है, एमिडिस वर्ड आ रहा है। कैसे याद करेंगे एमिडिस, तो AM का मतलब ये एक अमाइलॉइड, डिस का मतलब ये एक अमाइलॉइड डिजीज के ट्रीटमेंट में अप्रूव्ड है। तो एमिडिस वर्ड आएगा मतलब अमाइलॉइड डिजीज में अप्रूव्ड है। कौन सा ड्रग, ट्रांसथायरेटिन मेडिएटेड अमाइलॉइडोसिस में अप्रूव्ड है। ये बेसिकली क्या करते हैं, इस एबनॉर्मल प्रोटीन को मिसफोल्ड नहीं होने देते। These drugs they inhibit misfolding of this abnormal protein। तो मिसफोल्डिंग को तो हमने इनहिबिट कर दिया बेटा, वेरी गुड। अब एक और ड्रग है, अब आप बच्चे मुझे बता सकते हो पैटिसिरान, इसका मैकेनिज्म ऑफ एक्शन क्या होगा। Patisiran, again it is siRNA. Silencing RNA या small interfering RNA, it will inhibit the production of this abnormal protein. So ये तीन ड्रग्स बेटा अप्रूव्ड हैं फॉर द ट्रीटमेंट ऑफ अ रेयर डिजीज ट्रांसथायरेटिन मीडिएटेड अमाइलॉइडोसिस. नेक्स्ट वी हैव इज एटोपिक डर्मेटाइटिस टाइप 1 हाइपरसेंसिटिविटी. इसके लिए एक नया मोनोक्लोनल एंटीबॉडी अप्रूव्ड हुई है, लिब्रिकिक्सीजुमैब. Now librixizumab blocks, remember interleukin 13. किसको ब्लॉक करता है? ये interleukin 13 को ब्लॉक करता है. आपने ये बात याद रखनी है. And this drug has been approved in the treatment of atopic dermatitis. Now remember this drug is under trial और ये बहुत ही जल्दी अप्रूव हो जाएगा एक और एलर्जिक डिजीज के लिए. इट इज अंडर ट्रायल फॉर अ डिजीज नोन एज एस्थमा. ये एस्थमा में अप्रूव्ड हो जाएगा बहुत ही कुछ महीनों में और कुछ सालों में. इट इज अंडर ट्रायल, लगभग अप्रूव होने वाला है. नाउ लेट्स टॉक अबाउट अ न्यू ड्रग फॉर सीओपीडी दैट इज क्रॉनिक ऑब्स्ट्रक्टिव पल्मोनरी डिजीज. तो हम बेटा सब जानते हैं कि सीओपीडी में जो ब्रोंकस होती है वो कंस्ट्रिक्ट हो जाती है, तो ब्रोंकस बिकम कंस्ट्रिक्टेड. इसके लिए हम ऑलरेडी पढ़ चुके हैं टी और कॉफी में जो ड्रग मिलते हैं थियोफिलीन. थियोफिलीन अप्रूव्ड है और थियोफिलीन के दूसरे ड्रग अमाइनोफिलीन और इटोफिलीन भी अप्रूव्ड है. सर ये ड्रग काम कैसे करते हैं? थियोफिलीन रिमेंबर इट इज अ फॉस्फोडाइएस्टरेज 3, 4 एंड 5 इनहिबिटर. एग्रीड? ये फॉस्फोडाइएस्टरेज 3, 4 और 5 इनहिबिटर है. मेन इसका एक्शन 4 की वजह से है. Theophylline, it also block adenosine receptor. It is also an adenosine antagonist. Agreed? But problem ये होती है थियोफिलीन जो है बड़ा अनसेफ ड्रग है. इसकी थोड़ी सी भी आप डोज बढ़ा दोगे तो क्या हो जाता है? सडनली पेशेंट को टॉक्सिसिटी आ जाती है. दैट इज वाई वी डेवलप्ड अ न्यू ड्रग एनसीफेंट्रीन. एनसीफेंट्रीन लिखेंगे. इट इज अ फॉस्फोडाइएस्टरेज 3 एंड फॉस्फोडाइएस्टरेज 4 इनहिबिटर, जिसकी वजह से ब्रोंकस क्या हो जाता है? ब्रोंकस डायलेट हो जाता है. ठीक है. नाउ रिमेंबर इन एनफ्रीसेंटीन बिकॉज ऑफ फॉस्फोडाइएस्टरेज 3 इनहिबिशन दिस ड्रग कॉजेस ब्रोंकोडाइलेशन, एंड बिकॉज ऑफ फॉस्फोडाइएस्टरेज 4 इनहिबिशन इट हैज एंटी इंफ्लामेटरी एक्शन ऑल्सो. इसका एंटी इंफ्लामेटरी एक्शन भी होता है इन सीओपीडी. एग्रीड? नाउ नेक्स्ट ड्रग वी हैव इज न्यू ड्रग्स फॉर साइकेट्रिक डिजीजेस. सो अ वेरी इंपॉर्टेंट ड्रग, वेरी गुड चांसेस. जो ड्रग आपसे पूछा जा सकता है इन INICET एग्जाम दैट इज ज़ैनोमेलिन. ये ड्रग का बेटा नाम याद रखना है बिकॉज ज़ैनोमेलिन फर्स्ट इन क्लास ड्रग है फॉर द ट्रीटमेंट ऑफ स्किज़ोफ्रीनिया. मतलब इस मैकेनिज्म ऑफ एक्शन का और कोई भी ड्रग हमारे पास स्किज़ोफ्रीनिया या साइकोसिस के लिए अप्रूव्ड नहीं है. तो देखते हैं व्हाट इज ज़ैनोमेलिन. तो ज़ैनोमेलिन रिमेंबर इट इज अ मस्करिनिक रिसेप्टर एगोनिस्ट. रिमेंबर मस्करिनिक रिसेप्टर किसके होते हैं? मस्करिनिक रिसेप्टर पे नॉर्मली काम करता है एसिटाइल कोलिन और ये 5 रिसेप्टर होते हैं M1 to M5. ये पांचों रिसेप्टर को स्टिमुलेट करता है इन ब्रेन. सो बाय स्टिमुलेटिंग एसिटाइलकोलिन रिसेप्टर्स इट रिड्यूस द रिस्क ऑफ साइकोसिस या स्किज़ोफ्रीनिया. नाउ अब आपसे एक सवाल पूछा जाता है दैट जब हम ज़ैनोमेलिन देंगे, डोंट यू थिंक ज़ैनोमेलिन ब्रेन में तो एसिटाइलकोलिन के रिसेप्टर्स को स्टिमुलेट करेगा जो हम चाहते हैं और स्किज़ोफ्रीनिया ठीक हो जाएगा एंड द स्किज़ोफ्रीनिया विल बी ट्रीटेड. बट रिमेंबर दिस ज़ैनोमेलिन विल हैव पेरिफेरल साइड इफेक्ट. If it will stimulate this muscarinic receptor outside the brain, it will produce peripheral side effect of acetylcholine. And peripheral side effect of acetylcholine we have discussed, they are known as dumbbells. They are known as dumbbells. D for diarrhea, U for urination, M for meiosis, B for bradycardia, B for bronchoconstriction, E for excess of HCl production, lacrimation, salivation and sweating. All body secretions are increased. So remember, we want that ज़ैनोमेलिन should enter into the brain. But xanomeline should not produce peripheral side effect. It should not act outside the brain. That is why this xanomeline, it is combined with the drug trospium. It is combined with the drug trospium. What is this trospium? Remember, trospium is an anti-muscarinic drug. I hope you have understood the meaning. Trospium is an anti-muscarinic drug which will block, which cannot cross blood-brain barrier. So when you will combine trospium with xanomeline, trospium, it will go and reduce the peripheral side effect of xanomeline. It reduces all the peripheral side effect like dumbbells. So that is why it is always combined with trospium. It is always combined with trospium to block the peripheral side effect of xanomeline. Now for Alzheimer disease, remember, we have drug anticholinesterase, that is T-Duggar, tacrine, donepezil, galantamine, rivastigmine. They increase acetylcholine level, and acetylcholine improves memory in Alzheimer disease. Another drug which improves memory, MEM word is coming, memory improving drug is memantine. Now these were the previously approved drug for Alzheimer disease. Now remember what happens in Alzheimer disease. There is abnormal beta 1 amyloid deposition in brain, which leads to neurodegeneration in brain. This beta 1 amyloid protein, what happens? It leads to abnormal accumulation of beta 1 amyloid protein, put pressure on neurons. Neurons, they become damaged or degenerated because of pressure. So we have certain monoclonal antibody which targets beta 1 amyloid. So they remove this beta 1 amyloid protein from the brain. Now till now I was telling you two monoclonal antibodies have been approved. The first monoclonal antibody approved for Alzheimer disease was aducanumab. Aducanumab, how we can remember? It blocks beta 1 amyloid protein. It starts from the word A and D, that means Alzheimer's disease. The next monoclonal antibody approved was lecanemab. Again, the same monoclonal antibody which will remove beta 1 amyloid. Now a third monoclonal antibody has been approved. The third monoclonal antibody approved for Alzheimer disease is donanemab. So this is the new drug. How we can remember? AL means Alzheimer, D for disease. So remember ALD, Alzheimer's disease. So three monoclonal antibodies have been approved. Now let's talk about certain new antimicrobial drugs which have been approved. So the first antimicrobial or antibiotic approved for urinary tract infection, UTIs, urinary tract infection, is gepotidacin. Gepotidacin. Now beta, have you heard about a drug ciprofloxacin? Have you heard about a drug ciprofloxacin? These are fluoroquinolones, we all know. And beta, we all know that fluoroquinolones, they end with the word acin. Fluoroquinolones, they end with the word acin. Can we say gepotidacin is also ending with the word acin, just like ciprofloxacin? So remember, what is the mechanism of action of these two drugs? These drugs inside the bacteria which causes urinary tract infection, these drugs, they inhibit topoisomerase 4 enzyme and topoisomerase 2 enzyme. So they inhibit topoisomerase 4 and topoisomerase 2 inside the bacteria. Remember topoisomerase 2, it is also known as DNA gyrase enzyme. It is also known as DNA gyrase enzyme. So these drugs are given for urinary tract infection. Even fluoroquinolones are also given for urinary tract infection like ciprofloxacin or floxacin. Another drug which has been approved is, so this gepotidacin is an oral drug. Another drug which has been approved is sulopenem. Sulopenem can be given oral as well as IV. Now beta, can we see they are ending with the word penem? Penem word is coming. So it's a class of a drug known as carbapenems. Heard about carbapenems? So in carbapenems, which is a big group of antibiotics, they will also end with the word penem, like meropenem, one carbapenem group of antibiotic, imipenem. So similarly, we have another drug, penem word is coming, sulopenem. Now, where these drugs are given, remember these drugs are given for gram-negative urinary tract infection, and gram-negative urinary tract infection is most commonly caused by E. coli. It is also caused by Klebsiella. It is also caused by Pseudomonas, but mostly it is caused by E. coli. So they are given for gram-negative urinary tract infection. Yes, Neha Vishnu, you are absolutely right. Now, another drug which has been approved for urinary tract infection is one beta-lactam with beta-lactamase inhibitor. Now remember, we already have a drug, cefepime. I have told you any cephalosporin which has pi word in it, like cefepime, cefepirome, pi word is coming. It is a fourth generation cephalosporin. So it is a fourth generation cephalosporin. Now remember, fourth generation cephalosporins, they are given for the treatment of hospital acquired infection. They are given for the treatment of hospital acquired infection. Now all cephalosporins are beta lactams. So when this cephalosporin enters into the bacteria, let's say it entered into a bacteria, this bacteria produce one enzyme. This bacteria produce one enzyme known as BL, beta lactamase enzyme. So bacteria normally produce beta lactamase enzyme, and beta lactamase enzyme, remember, degrade cephalosporin. Beta lactamase enzyme degrades these cephalosporins because cephalosporins are beta lactam group of antibiotic which inhibit cell wall. So that is why we combine this cefepime with a new drug N-metazobactam. N-metazobactam. So N-metazobactam, how we can remember? You can see bactam word is coming. Bactam we can write it as, it is a beta lactamase inhibitor. So can we remember bactam word? It is the beta lactamase inhibitor. And you can see some metazo word is coming. Some metazo word is coming. So it is a metallo. It is a metallo beta lactamase inhibitor. So which type of beta lactamase inhibitor? Metallo beta lactamase inhibitor. This type of metallo beta lactamase enzyme, it is produced by very resistant bacteria in hospital. So it is given for hospital acquired infection. Now beta, can you tell me, any patient who is admitted in the hospital, what kind of infection you can see in a patient of hospital acquired? Can we say a patient who are admitted in hospital, they are on ventilators, they have Foley's catheter? So if a person is on ventilator, it can lead to pneumonias, infection can go inside. And if there is a Foley's catheter, it can lead to urinary tract infection because a bacteria can go upward with the help of Foley's catheter. So they are given in the treatment of VAP. Anyone, what is the full form of VAP? VAP stands for ventilator associated pneumonia. Can you tell me what is COTY? Can you tell me what is COTY? COTY stands for catheter associated urinary tract infection. So these are the certain hospital acquired infection. We have developed a new drug to protect cefepime, and metazobactam protects cefepime. Now we have a new drug for molluscum. Molluscum contagiosum, it can cause warts, especially in children and HIV positive people. Now the first drug which we approved for molluscum was imiquimod. What was the first drug to be approved? Imiquimod. Beta, imiquimod, what is this drug? It is an immunity modifier. That means it increases the immunity of the body, and this immunity or WBC, they will come and kill up this cancer cells. kill up this virus infected cell imiquimod. Now, the second drug or new drug which has been approved for molluscum is baldazamir. Baldazamir is a new class of a drug. It is a nitric oxide donor. It is a nitric oxide donor, and this nitric oxide can directly kill viral infected cell. And both these drugs, remember, baldazimir and imiquimod, both these drugs are topical drug, because what is a topical lesion on skin? It is a topical lesion on skin, so they are available as a topical cream or topical injections directly into the skin. Next drug we have is catheter related bloodstream infection. Now what does it mean? Suppose there is a patient in which you have started some drip. Suppose you have started a drip. Now don't you think this drip will have needle in it? This drip will have needle in it, and this needle, it is attached to skin. It is injected into the skin. Now, don't you think on our skin we have various bacteria? We have various bacteria on our skin like Staphylococcus, similarly Enterococcus. Don't you think these bacteria can enter into the blood if we put some catheter? That is why, to prevent this catheter related bloodstream infection, we have a new drug, taurolidine. Now, what is taurolidine? Taurolidine, it is a derivative of one amino acid taurine. So, it is a derivative of amino acid taurine. And it has been seen that this taurine, it kills the cell wall of a TB bacteria. So it inhibits cell wall cut. I'm really sorry. It inhibits the cell wall of a bacteria, and this drug has been approved for the treatment of MRSA. MRE. Can you tell me, beta, what is MRSA and MRE? Can you tell me what is MRSA? That is methicillin resistant Staphylococcus aureus. Similarly, MRE will be methicillin resistant enterococci. Remember, in MRSA and MRE, we give a drug vancomycin. It is even effective in vancomycin resistant Staphylococcus aureus and vancomycin resistant enterococci. To prevent bloodstream infection, taurolidine is a new antibiotic which has been approved. We put this taurolidine in this same syringe. इसी कैथेटर में, इसी ब्लड वाली सलाइन में हम क्या करते हैं, taurolidine डाल देते हैं. Okay, and it will inhibit the entry of Staphylococcus and Enterococci into bloodstream through catheter. So now let's talk about certain new drugs for endocrinal disease. So we have a disease, a genetic disease, primary biliary cholangitis. So beta, what happens in primary biliary cholangitis? There is accumulation of bile. There is accumulation of bile in ducts. So there is excessive accumulation of bile in ducts. Remember, this bile, it causes inflammation. Because of inflammation, remember, there is cholangitis. Bile ducts, what will happen? There will be cholangitis, and slowly what happens? The bile ducts, they become fibrosed, scarring up happens, and there is blockage of bile ducts. Now remember one point. How does liver produce bile inside itself? Remember, inside the cell, liver cells, so let me draw a liver cell. So suppose this is a liver cell. Inside the liver cell, there is a receptor known as PPAR receptor. This PPAR receptor is responsible for bile production. Sorry. This PPAR receptor, there is a PPAR receptor which stands for peroxisomal proliferator activating receptor. So let's talk about how do these drugs they will act. The first drug which is approved is elafibranor. Elafibranor is a dual PPAR alpha plus delta agonist. It stimulates this alpha and delta receptors. It stimulates PPAR alpha and delta receptor. Stimulating this receptor decrease bile production. Stimulating this receptor reduces bile production in primary biliary cholangitis. Now, next drug is very easy to identify. You can see Sela del Par. Par word is coming. So again, it is a PPAR. Par word is coming. Now you can see Dela word is coming. Del word is coming. Dela or Del word is coming in it. So can you tell me which type of receptor it will stimulate? It will only stimulate PPAR delta agonist. It only stimulate which receptor? PPAR delta. Again, it will reduce the production of bile, and that is why it will reduce inflammation in cholangitis. Yes, you are absolutely right, Vishu. There is another drug, fibrates. Fibrates are not approved right now for primary biliary cholangitis, but yes, there is one more drug which can be given in primary biliary cholangitis. Remember, both these drugs, they are given as an add-on to UDCA. Can you tell me what is UDCA? UDCA stands for ursodeoxycholic acid. Ursodeoxycholic acid also stimulate PPAR receptor. So the first drug which was approved for primary biliary cholangitis was ursodeoxycholic acid. Now we have new drugs which are given as an add-on drug with ursodeoxycholic acid for primary biliary cholangitis. Okay, very good. Now let's talk about congenital adrenal hyperplasia. So beta, what happens in congenital adrenal hyperplasia? Let's say there is an adrenal gland, and let's say there is a deficiency of an enzyme 21 beta hydroxylase. So let's say there is an enzyme 21 beta hydroxylase enzyme. Its deficiency is there in adrenal gland. So there is a genetic deficiency. So what will happen? Because of this reason, adrenal gland will not able to produce glucocorticoid and mineralocorticoid. If glucocorticoid and mineralocorticoid are not produced, beta, can you tell me what will happen to the level of ACTH hormone and CRH hormone? Can we say there will be no negative feedback? There will be no negative feedback. So the level of CRH, corticotrophin releasing hormone, and ACTH hormone increases. And these hormones, they increase the size of adrenal gland. So this is known as congenital adrenal hyperplasia. Now, what is the first treatment of congenital adrenal hyperplasia? First treatment is give glucocorticoid and mineralocorticoid replacement. So can we give this glucocorticoid and mineralocorticoid from outside? Yes, we can give glucocorticoid and mineralocorticoid replacement, like the drugs are hydrocortisone. Hydrocortisone is also known as cortisol. So we can give this drug. Now we have a new drug, very easy to identify, crinecerfont. Crinecerfont, what it will do? Very easy. So see the first four word of crin. See the first four word. Crinecerfont. So I will write like this: CRIN. So let me write like this: CRIN. First four word. So it is a corticotrophin releasing hormone. It is the corticotrophin releasing hormone receptor inhibitor. So it is a corticotrophin releasing hormone receptor inhibitor. Now, I hope you have understood what it will do. It will go and decrease the production of corticotrophin releasing hormone so that ACTH is not produced, so that the size of adrenal gland will not increase. So it will act on brain and directly reduce the production of corticotrophin releasing hormone inhibitor. So it's a new drug for congenital adrenal hyperplasia. Right now it has been approved as an add-on drug to it has been approved as an add-on drug to glucocorticoid and mineralocorticoid replacement. So it is given as an add-on drug with cortisol. I hope you have understood. Simple and easy. Now let's talk about WHIM syndrome. So what is WHIM? A very rare disease. So new drugs are generally approved for rare disease. WHIM beta stands for warts, hypogammaglobulinemia, infections, and myelocathesis. Now what do you mean by myelocathesis? Any student who can tell me what do you mean by the word myelocathesis? Akathisia means or akathesis means that the WBC or myeloid cell, we know that myeloid cells are present in bone marrow, and bone marrow, remember, it releases this RBC, WBC and platelets into the blood. So from bone marrow, RBC, WBC and platelets, they come into the blood. They are released from the bone marrow. Myeloacathesis means that bone marrow is not able to release these blood cells into the bloodstream. Now, sir, why they are not able to release? Because there is one receptor. There is one receptor in our bone marrow. This receptor is known as CXCR4 receptor. There is a receptor in our bone marrow known as CXCR4 receptor. This receptor attaches myeloid cell. Myeloid cells, they become attached to CXCR4 receptor. Because of this reason, this receptor will not allow these bone marrow cells to come into the blood. So what will happen, beta? Can we say if WBC will not come, immunity of the body will reduce? So there will be hypogammaglobulinemia. It will lead to infections. And there will be warts. Warts is a kind of infection. This is known as WHIP syndrome. Now the first drug which has been approved for the treatment of WHIP syndrome was Plerixafor. सबसे पहला ड्रग क्या था बेटा? Plerixafor. So what is Plerixafor? Plerixafor inhibit CXCR4 receptor. So it is a CXCR4 inhibitor. Now we have a new drug, Mavorixafor. Again, Rixafor word is coming. I means it also inhibit which receptor? CXCR4 receptor. Because it inhibits this CXCR4 receptor, what will happen? Now these myeloid cells will not remain inside the bone marrow. It will now get easily released into the blood. It will now get easily released inside the blood. So a rare condition, the drug is Rixafor. Rixafor word is coming. Now we have Duchenne muscular dystrophy. So it is the most common genetic dystrophy which is seen in small children. The first drug which has been approved for Duchenne muscular dystrophy is one corticosteroid. Which corticosteroid has been approved? That is deflazacort. Deflazacort decrease inflammation or muscle damage in Duchenne muscular dystrophy. Now beta, these were the previously approved drug. And to learn about the first three drugs, just see the previous video of new drugs which I have posted in my group. Now in this section, try to remember a new drug which recently got approved. That is Givonostat. Remember, any drug which ends with the word nostat Any drug that ends with the word no stat, remember there is a rule. No stat inhibitor, these drugs are histone deacetylase inhibitor. These drugs are histone deacetylase inhibitor. Any drug that ends with the word no stat. Similarly, let me write a drug name. Heard about a drug? Vorinostat, Belinostat, Panobinostat. So don't you think all these drugs, they are ending with the word no stat, and any drug that ends with the word no stat is a histone deacetylase inhibitor. Now these drugs are given in the treatment of various cancers. So I have told you vorinostat previously given for cutaneous T cell carcinoma, belinostat, panobinostat, it is given for multiple myeloma, है ना? But this jevinostat is a new drug given for Duchenne muscular dystrophy. Duchenne muscular dystrophy, new drug is jevinostat. It also reduces inflammation in Duchenne muscular dystrophy. It has anti-inflammatory property. Now let's talk about certain new drugs for blood disorders and other miscellaneous new drug. So first, a new drug for hemophilia A. So beta, you all know that hemophilia A, there is a problem with. There is a problem with which factor? There is a deficiency of factor 8. है ना? Agreed? Now, we have a drug emicizumab. Now, what is emicizumab? You can see E word is coming. So, you will write emicizumab is a factor 8. Remember E for 8. Emicizumab is a factor 8 monoclonal antibody. And you can see it is not factor 8. It is not factor 8. You can see a word mic word is coming. Mic word is coming. It is a factor 8 mimicker. It is a factor 8 mimicker. That means this monoclonal antibody mimics which clotting factor? It mimics factor 8. So imicizumab 8 mimicker, and when 8 factor, how it mimics factor 8? It increase the binding of factor 9 with factor 10, because all clotting factor, they increase each other activity. Factor 8 increase the binding of factor 9 with 10. So imicizumab is a monoclonal antibody which mimics factor 8 and increase the binding of factor 9 and 10 together. Remember, it is a very good drug for hemophilia A. Agreed? Till now, for the treatment of hemophilia A, we were giving recombinant factor 8 from outside. For the treatment of hemophilia A, we were giving factor 8 from outside. Problem with factor 8 was, it was a very short acting drug. You have to give multiple transfusion. But when we make imicizumab, it's a very long acting drug. You don't have to give again and again recurrent transfusions of factor 8. Another drug we have is fitusiran. So again, beta, can you see fitusiran? SI ran word is coming. So it should be what it should be. It is small interfering RNA. It is a small interfering RNA, yeah, siRNA, and this iRNA inhibits the activity of antithrombin. It inhibits the factor activity of antithrombin. Remember, normally antithrombin inhibits factor 9 and 10. Normally antithrombin inhibits or reduce the activity of factor 9 and 10. So if we inhibit antithrombin, can we say now the activity of factor 9 and 10 will be increased, which will be beneficial in hemophilia. Another new drug recently got approved is concizumab. Concizumab is a monoclonal antibody which inhibit anti-tissue factor. It inhibit anti-tissue factor. So if you inhibit anti-tissue factor, again, the activity of factor 9 and 10 clotting factor will be increased, and they are beneficial in hemophilia A. So these are the three new drugs you have to remember in hemophilia A. I think imicizumab is an important drug for you. Imicizumab. Next, we have a disease which occurs because of activation of, which increase because of activation of complement pathway, which leads to inflammation, damage of RBC, and this disease is known as paroxysmal nocturnal hemoglobinuria. So while sleeping, the patient has red color urine or hemoglobinuria. The first drug which we approved for PNH was eculizumab. Eculizumab is a monoclonal antibody which inhibits C5 complement, Now eculizumab, then we made ravulizumab. Ravulizumab, another monoclonal antibody which inhibit कॉम्प्लीमेंट फैक्टर 1. अब बेटा हम ये बात कैसे याद करें? एक लड़का था राहुल. राहुल मतलब राहुल में बेटा कितने वर्ड आ रहे हैं? 5 वर्ड आ रहे हैं. वो बहुत ही अकेला था. क्या था बेटा? अकेला था. ऐसे याद कर लो. राहुल एक लड़का था, वो बता अकेला था. अकेला में भी बेटा कितने वर्ड आ रहे हैं? अकेले में भी कितने वर्ड आ रहे हैं बेटा? राहुल और अकेला C5 कॉम्प्लीमेंट. ठीक है. रिसेंटली अ न्यू ड्रग गॉट अप्रूव्ड, दैट इज क्रोवालीमैब. क्रोवालीमैब इज ऑल्सो अ न्यू ड्रग which inhibits C5 complement. Then we have pegcetacoplan. Pegcetacoplan, remember, it inhibits C3. C3 complement. Then we made a new drug iptacopan. It also inhibits C3 complement. These are the new drug. Then we have a newer drug danicopan. It inhibits factor D. Factor D is a part of complement pathway. Danicopan, D for factor D. So try to remember eculizumab and ravulizumab. They are important for you. इस पे eculizumab has been asked in INICET exam. Now we have chemotherapy induced neutropenia. Beta, we all know that chemotherapy means anti-cancer drug, and anti-cancer drugs, they can go to bone marrow, and in bone marrow they can kill the cells of bone marrow, which can lead to neutropenia. So the first drug which we have approved for chemotherapy induced neutropenia was filgrastim. So you can see grastim word is coming. Grastim stands for granulocyte. What are granulocyte? Granulocytes are neutrophils. Stim word is coming. It is a granulocyte stimulator which increase neutrophil count. Given for chemotherapy induced neutropenia. Now what is this filgrastim? Remember, filgrastim is basically GCSF. It is a protein known as GCSF. G stand for beta granulocyte. It is a granulocyte colony stimulating factor. So this protein is also produced inside our body, which increase the production of neutrophil. Now the problem with filgrastim was that filgrastim is given subcutaneous injection daily. You have to give daily injection. That is why now we have made a new drug, and this new drug, which has a longer name, FB melinogastrim. Again, you can see gastrim word is coming. It is also granulocyte colony stimulating factor, but this drug is a long acting drug. It is given subcutaneous injection once during whole chemotherapy period. Now what does it mean? Suppose we are giving chemotherapy. Let's say that chemotherapy is lasting for 14 days. I am giving an anti-cancer drug for 14 days. Don't you think it will lead to bone marrow suppression, neutropenia? So what happens? Filgrastim has to be given for whole 14 days. That means every day we have to give filgrastim injection for regular 14 days. But we have now made another gastrin wala drug with a bigger name. Name you don't have to remember. Identify gastrin word. Now this drug has to be given only once in whole chemotherapy period. Suppose chemotherapy is for 14 days. We have to give one injection in 14 days. Agreed? So that is why we have made it. Now let's talk about graft versus host disease. Remember, in graft versus host disease, what we have to do? We have to reduce immunity of the body. We have to reduce immunity of the body to prevent graft rejection, so that this transplanted organ or a graft should not be rejected by body immunity. We have the first in class drug, exatilimab. Exatilimab block CSF. Now, can you tell me what is CSF? It blocks colony stimulating factor. Because it blocks colony stimulating factor receptor, it will decrease the neutrophil count. Filgrastim was increasing neutrophil count. Exatilimab reduces neutrophil count, which will reduce the immunity of our body. So don't you think one same target GCSF, one we are stimulating by filgrastim to increase neutrophil count in chemotherapy induced neutropenia. Another drug we have is block CSF, reduce neutrophil count. Potential use should be graft versus host disease. Okay, yes, opposite action. You're absolutely right. Now let's talk about certain new anti-cancer drug. So first is HR positive breast cancer. So HR beta stands for hormone receptor positive. HR stands for hormone receptor positive breast cancer. Suppose beta this is a cells of breast cancer. Remember, breast cancer cells, they express one receptor on their surface, ER positive. ER means which hormone? Estrogen receptor positive breast cancer. Remember, if this breast cancer expresses estrogen receptor, remember this estrogen when acts on this receptor, it causes cell division. It causes cell division. Now, how estrogen receptor causes cell division? When estrogen receptor is stimulated, remember it starts a pathway. It starts a pathway inside the breast cancer cell, that is PI3K pathway. I will tell you the full form. This PI3K pathway, it leads to cell division. It leads to cell division. Now, the first drug or the drug of choice for treatment of breast cancer is, let's block estrogen receptor by a drug tamoxifen. Drug is tamoxifen. So what is tamoxifen? Tamoxifen blocks estrogen receptor on breast cancer. Another drug you can remember is fulvestrant. Fulvestrant. ESTR, means antagonist. ESTR means estrogen antagonist. Now, if there is resistant cases of tamoxifen, what we do? In resistant cases of tamoxifen and fulvestrant, we give a drug palbociclib. Palbociclib. कौन सा ड्रग देते हैं बेटा? Palbociclib. We add on drug this drug. Now what is palbociclib? Palbociclib is CDK4. Palbociclib is CDK4 and 6 inhibitor. Anyone beta, what is CDK? CDK stands for cyclin dependent kinase. Cyclin dependent kinase. Cyclin dependent kinase is responsible for cell division, cell cycle transition. CDK inhibitor we have is palbociclib. If still the breast cancer is resistant, we have developed a drug inavolisib. Inavolisib is PI3K inhibitor. PI stands for phosphatidyl inositol kinase pathway. Heard about IP3 pathway? Inositol phosphate kinase pathway. This inositol phosphate kinase pathway is a pathway which is started by estrogen receptor. It leads to cell division. So inavolisib inhibits this PI3K. It is given as an add-on drug. Can you tell me it is given as an add-on drug to which drug? It is given as an add-on drug with tamoxifen, with palbociclib, with inavolisib. With inavolisib. So remember I से कुछ I वर्ड आ रहा है इसमें, इनोसिटॉल वाला, इनोसिटॉल वाला वर्ड आ रहा है, इनोसिटॉल, तो इसमें भी कुछ इनोसिटॉल वर्ड आ रहा है, इनावोलिसिब. Agreed? Now, another drug we have to remember is a new drug, datopotamab. Datopotamab. Remember, these receptors, they also express one protein, TROP2. This TROP2 protein is seen in HR positive breast cancer, estrogen receptor positive breast cancer. It is a type of growth receptor which causes cell division. So datopotamab, it inhibit TROP2 receptor on breast cancer. It inhibits TROP2 receptor on breast cancer. So it is also approved a new drug for HR positive or estrogen receptor positive breast cancer. Now let's talk about non-small cell lung cancer. The most common cancer in the world is non-small cell lung cancer. Now in lung cancer, the most common mutation which is seen in lung cancer is EGFR mutation. The most common mutation seen in non-small cell lung cancer is EGFR mutation. EGFR beta stands for epidermal growth factor receptor mutation. So if this receptor becomes mutated, it leads to non-small cell lung cancer. It is the most common mutation. The third most common mutation seen in non-small cell lung cancer is ALK mutation. Beta, ALK stands for anaplastic. Both of them have been asked in your INICET exam. Anaplastic lymphoma kinase mutation. So these are the most common mutations which are seen in most common cancer in the world, that is non-small cell lung cancer. So we have developed EGFR inhibitor. The already approved drugs are erlotinib. Already approved drugs are erlotinib, geftinib, osimertinib. So try to remember beta a word ego. So ego वाले drugs कहां दिए जाते हैं? They are EGFR inhibitor. They are given for EGFR positive breast cancer. Now we have developed a new drug. That new drug is lazertinib. Lazertinib. Now this lazertinib, it is given in combination with one drug known as amivantamab. Amivantamab and cetuximab. These are the two monoclonal antibodies which inhibit EGFR. These two monoclonal antibodies, they also inhibit EGFR. So they are given as an add-on drug with amivantamab. Now ALK inhibitor, previously approved drug which are ALK inhibitor are crizotinib. It has been asked in your INICET exam. Alectinib and seritinib. These are the previously approved drug for ALK positive lung cancer, non-small cell lung cancer. Now a new drug is ensartinib. It's a new drug, ensartinib, which is given for ALK positive non-small cell lung cancer. Now a very unique drug which has recently been approved. I would say it is the first unique type of monoclonal antibody approved. That drug is tarlatamab. Tamab, Tarlatamab, and it is a bite immunotherapy. Now, what does it mean? Let me make you understand. Remember, cancer cells, they can hide or bypass from our body immunity. They escape our body immunity. So, if we can stimulate our body immunity, don't you think it can go and kill cancer cells? So, what we have done, suppose this is a T cell. This is a T cell, and we know that all T lymphocyte, they contain a pan receptor, CD3 receptor. Normally, this CD3 receptor attaches to some receptor on cancer cell, which we don't have to remember. Let's say this receptor is some DLL3 receptor. And when this receptor attaches to this cancer receptor, these T cells will kill cancer cells. Now we have made a special type of monoclonal antibody, tarlatamab. Tarlatamab is a bite immunotherapy. Now, what do you mean by bite? Let's write what does bite stands for. Bite stands for bispecific. Bispecific T cell engager. Now, what you have understood from this word? Tarlatamab, Tarlatamab, it increase the binding of CD3 receptor with cancer receptor. Now T cells can easily bind to cancer receptors and it will go and kill this cancer cell. It is the first monoclonal antibody which has specifically been approved for the most dangerous form of lung cancer, that is small cell lung cancer. It is given for small cell lung cancer. Previously approved drug I have told you for non-small cell lung cancer. Yes, beta, PDF will be given. So now let's finish our topic. Let's finish our lecture. Last two slides. Certain new anti-cancer drug. We have Revumenib. Menib word is coming. It is a menin inhibitor. Remember menin. Menin, it is produced by a gene known as MEN gene. Have you ever heard about MEN gene or MEN syndrome? Heard about MEN gene or MEN syndrome? Yes, that is multiple endocrinal neoplasia. It leads to variety of cancer. So this menin protein which is produced by MEN gene, it causes cell proliferation. So these drugs have been approved. Revumenib, it has been approved for refractory or relapsed cases of acute leukemia. Then we have a drug, vorasidenib. In vorasidenib, you can see ID word is coming and nib word is coming. So you will write it is an IDH, nib means inhibitor. It is an IDH inhibitor. Now what is IDH stands for? IDH stands for isocitrate dehydrogenase. Beta, this enzyme, isocitrate dehydrogenase enzyme, it is responsible for cancer or cell division. This enzyme, if it becomes overactivated, it can lead to cancers or cell division. Let's inhibit this enzyme. So the drug is vorasidenib. ID, nib word you have to identify. A new drug recently got approved for astrocytoma or oligodendroglioma. Remember, for astrocytoma and oligodendroglioma, the drug of choice is temozolomide. The drug of choice is beta temozolomide. So it is given as an add-on drug with temozolomide. It is given as an add-on drug with temozolomide. Sir, is there any previously approved drug which is also an IDH inhibitor? Yes, there is a previously approved drug, that is ivosidenib. Can we say ivosidenib? It is also inhibiting with the same word idenib. It is also an IDH inhibitor. It is given for cholangiocarcinoma. It was approved in year some 2021 or 2022. But we are only discussing the drugs which have been approved from 2023 to 2025. Then we have a new drug, imetilstat. email, tilstat. You can see tel word is coming. Tel means it is a telomerase. Stat means inhibitor. So telstat word is coming. It is a telomerase. Stat means inhibitor. So you know that telomerase enzyme inhibits the shortening of chromosome so that cells survives. So if you inhibit telomerase, it will lead to shortening of chromosome or DNA damage and the cells now will easily die. So telomerase inhibitor, new drug approved for MDS. MDS stands for myelodysplastic syndrome. Myelodysplastic syndrome. Lastly, we have certain new monoclonal antibody, Genokutuzumab. So it inhibits HER2 and HER3 inhibitor, given for lung cancer and adenocarcinoma. We have Jani-Datamab. It is a only HER2 inhibitor given for biliary tract cancer which expresses HER receptor. But what is HER? HER stands for human epidermal growth factor receptor. Beta, if there is any mutation in this growth factor receptor, it can lead to abnormal cell division or cancer, HER receptor. Then we have Cosibelimab. It is a PDL1 inhibitor. We have discussed PDL1 in the previous section. PD stands for program death ligand inhibitor. So we have discussed program death in the previous section. You can see it is approved for cutaneous small cell carcinoma. And the last drug we have is Zolbetuximab. TU word is coming. It is for some tumor. And Zolbetuximab, it blocks Claudin 19. Remember, Claudin is a protein which attaches cells together. Claudin is a protein which attaches the cells together. It forms tight junction. Now remember, if there is any mutation in Claudin protein, what will happen? Cells become separated easily, and these cells, because they become free, they metastasize very easily. So this Claudin mutation is commonly seen in stomach or gastroesophageal junction adenocarcinoma. So it's very commonly seen. Yes, Sanjeet, Snehajit, you're absolutely right. So let's block this abnormal type of Claudin protein, which is causing metastasis of common cancer cells. So we have a drug Zolbetuximab. So these are the certain new drugs, new target in year 2023 to 2025. So this is all for today's lecture. I hope you have enjoyed each and every concept what I have told you. So try to use this series before your NEETPg and INICET exam. Do it fast forward. I will share the PDF on the group. Now you must be asking, you can share this screen code, take a screenshot, and you can share this screenshot with your friends who want to see this series or specifically this lecture. And lastly, I'll share the PDF on Telegram group. You can see this Telegram group. And if you have any doubt, you can ask me on Instagram. And YouTube channel link is there, Facebook link is there. So this is all for you. So this is for this year's upcoming exam, new drugs approved. You can see the previously approved drug from 2023 to 2025 in a similar video in this channel. आप इसी channel पे देख सकते हो पहले के approved drug. So we will be coming with the new drugs next year now. Okay. So thank you very much, Sneha, Vishnu, everyone to taking out your time. So use this video just before your exam, 2-3 days before your exam. That will really help you for upcoming INICET and NEET exam. So best wishes. Thank you very much. Goodbye. Enjoy your day.